So my camera is shut off, so we're picking up where we left off. So I was just saying that if somebody comes in and is presenting with pretty classic carpal tunnel syndromes, we're going to open the wrist quite a bit. So I might be doing some myofascial release on them, meaning getting some grip, some friction into the skin, starting to sink a little bit deeper into the muscles, perhaps with a downward motion, and having them open up their wrists. So you can kind of do that on your own, as I'm demonstrating right here, just opening up one finger at a time, and you'll feel that pull through the wrist here. You can also just open, move back and forth, close your fist. We're just getting everything loosened, and really kind of isolating this area to focus on. However, a lot of times carpal tunnel might not be what's going on. So as my handy book here describes, possibilities that something else might be going on often include like neck injury, a general nerve impairment, which I see all the time, both in my own body and in clients' bodies, and other wrist injuries. So we're going to talk a bit about the general nerve and impairment that is so common and often, presents similarly, with tingling, pins and needles, burning, shooting pains, intermittent numbness, weakness. Like, these are signs and symptoms of carpal tunnel, but these are often signs as well as like general nerve impairment. And as I think we talked in the last video, or I alluded to, that we have what's called the let me grab my other book here. Boop, boop, boop. And move my cat a little bit. All right. So, the brachial plexus, which is the network of nerves that supply the arm with sensation and motor control, consists of spinal nerves C5 through T1. That's getting a little technical, and you break that down a little bit. So basically, we have this nerve complex that's in our cervical spine, comes all the way down and through the pec, especially pec minor, which pec minor is that little bandy muscle that kind of goes from arm into chest. It gets really compressed anytime we are forward, like our arms are forward. So you can imagine this is often an area that I am opening when people are getting tingling and numbness in their wrists and hands. And I don't know, just from kind of anecdotal evidence, a lot of times I'm noticing that in the pinky, and in myself and other people, where it's actually the other, the pinky and the finger close to it, that often end up having some symptoms that, are different than the other part of the hand that we just talked about a minute ago from carpal tunnel. Not always things, you might have it anywhere in your hand depending on exactly what nerve on either side or through the middle, what's happening. But going back to what I was describing about this nerve complex, so it's traveling down through the arm, and it basically innervates, or nerves go into all the way down the arm into fingertips. So if you have something that is angry or closed in on or tightened up or tensed up, all along that path, you might get some symptoms, whether it's in your neck, in your chest, in your elbow's a big point. Anytime you have a joint you know, like that is going to especially be a place that things can kind of get caught. You know, we have joints all the way up and down this whole complex here. So, what do we do about that? Well, thinking of this as like a full system, you know, I would recommend, you know, getting all of this moving. So even if you might be only really having symptoms in your hand, you're like, what's happening? Like, is your neck also tight? Like, especially kind of like this part of your neck? If so, like, maybe let's do a little bit of opening. And you can check out my neck stretching videos, which I will link in the comments. You can, if you feel some tension like through the pecs, you know, get into your pecs, which I will also link in the comments. Again, all the way down the arm, similar to stuff we did in the last video, like squeezing and pulling, opening up, you know, your upper arm, opening up your elbow, like really kind of doing some nice circles around all those bony parts of your elbow, like pulling out along the elbow, along the forearm. Just imagining, again, we're creating space for all those nerves coming down, helping out our hands, getting the hand involved itself. Alright, let's see if there's anything else nerdy that I wanted to share with y'all from my book here. I think that's going to be about it. I want to keep it fairly simple today, but please let me know if you have any additional questions about any of those things, and I'm happy to follow up with some more videos specifically about these conditions and what you can do to make your life a little easier. Alright, y'all, take care.